Thank you very much and welcome to the Cabot Institute for the Environment Annual Lecture 2024. As always, it's great to see such a big turnout of people. We hope that today's session will be exciting, stimulating. We have a great panel. We have a very, very good keynote speaker, so I'm sure you will enjoy this hugely. Before I talk a little bit about today's lecture, I really need to thank the Bristol Collegiate Research Society for the generous funding that they've given to support today's event and the showcase. We are really appreciative of that, and we really welcome you, John and colleagues, to be here, and we hope that you find this a good, stimulating event and meeting the kind of objectives that you set yourselves as a society. So let me just turn to our event, and I do promise I will stop speaking very shortly. The focus today is around planetary health, and I don't think it's ever been more important that we start to think about this and start to think about the health of our planet and how that affects and impinges on our own health. I'm very pleased to say that our keynote speaker is Professor Sir Andy Haines from London School of Hygiene and Tropical Medicine. So Andy trained as a doctor. He's had various roles within the NHS, but also within academia. Perhaps most importantly, Andy has really been at the forefront and a pioneer of the thinking around planetary health and trying to shape the agenda and trying to galvanize action. As I said, it's probably never been a more important time. The world faces various environmental crises, the climate crises, biodiversity, pollution. In addition, we retain and remain suffering from massive inequalities and poverty that also drives people's ill health. And that inequality is not just between countries. We see it here in our own city in Bristol and right across the UK. What we're increasingly recognizing, though, is if we as a human species are to be healthy and to be successful, we need our planet to also be healthy. We have to recognize that this amazing planet has given us a set of resources. But if we don't try to live within those resources, the health of our planet will deteriorate, and ultimately, so will our own health. So really understanding this complex interaction about how we need our planet to be healthy in order for us to be healthy feels like it is the defining issue probably of the 21st century. So I'm going to hand over to Andy, who is going to be able to articulate and explain that far more clearly than I. But please, Andy.
Thank you so much for inviting me to speak. It's a great pleasure and a privilege for me to do so. You've given me a very small topic to cover in 20 minutes. What I'm going to try and do is to give you a panoramic overview of this topic of planetary health, which is an evolving concept. My background is that, as you've heard, I was a practicing doctor for many years. And in, I suppose, about the late 80s, I began to hear about this concept of climate change. And it seemed to me, having worked in different countries with different planets and different disease programs, that climate change would have impact on human health, but no one was talking about it. And so I began to write about it. Initially, no one was, only few people were interested, but the maintenance gathered, of course. And in recent years, thanks to the Wellcome Trust and other big funders, we've seen a big escalation of interest in the linkages between the environment and human health, particularly some of these global environmental trends. About 10 years ago, I was approached by the editor of The Lancet, which many of you have heard of, Dr. Richard Hall. It's a major medical journal, and he asked me to chair a commission on the topic of planetary health. Initially, I was a bit skeptical. I thought, well, that's open to misinterpretation. You know, maybe people think, well, because it's planetary, then I as an individual don't have any role to play. And of course, that's not true. It all happens at whatever the individual, the community, the city, the nation, and then, of course, the globe. And so what we tried to do was to bring together the evidence on the global environment, but also linking that to human health. And is to read our report, now nearly 10 years old, downloaded from the Lancet website. And then a few years ago, I co-wrote this corporate planetary health. We're trying to bring up some of the science more up to date and articulate it in a bit more detail. And I was very influenced by this planetary boundaries framework. And you can see here the way that's evolved over recent years. In 2009, Johann Armstrong, the late Will Stephan and others proposed that there were 7 planetary boundaries. and 3 of those had already been crossed. And you can see how that's evolved over recent years, so that by 2015, by the time we wrote our report, we published it, there were 4 of the planetary boundaries crossed. And by 2023, science had evolved. There were now thought to be 9 planetary boundaries, of which 6 had been crossed. And you can see how biodiversity, for example, land use change, the climate, even these novel entities, pollutants, for example, are becoming pervasive in the environment. So these are complex changes, and they will have complex interrelated effects on human health and well-being. So this concept of planetary health, the way we tried to define it very simply in our Lancet Commission was that it was the health of human civilization and the state of the natural systems on which it depends. And traditionally, public health has really focused on improving the health of the population, but it hasn't taken any notice of the environmental impact of human societies. And it's important that we do that, because if we don't, as we've already heard, then the impacts that we as a human population are having on the environment can undermine the prospects for health, both now and increasingly, of course, in the future, for future generations. So we have to be very careful that in gaining better health for ourselves and our loved ones, we don't undermine those prospects for the future. And you can see the evolution of these concepts from public health into global health, an attempt to globalize some of these concepts, but again, not taking into account the environment. One Health, which comes from veterinary medicine, which is about the linkages between mainly zoonotic diseases transmitted from animals into humans, and then Planetary Health, which is a broader concept, as I've suggested. And there's a lot of work going on to integrate these concepts of planetary and One Health. So this infographic is an attempt to summarize what is a complex picture. It's only doing it for one of the boundaries, which is climate change, because that's the one we understand. We still don't understand a lot, but we do understand quite a lot about the impacts of climate change on human health. And of course, these will interact with all the other planetary boundaries. And at the top, you can see the increasing levels of carbon dioxide, which is the most important greenhouse gas, but also methane, which is a short-lived greenhouse gas, stays out in the atmosphere for about 12 years or more. Or so, and that is causing climate change. And then through a range of local environmental factors, socioeconomic factors and others, these are having a range of impacts on health around the world. So although climate change is a global phenomenon, the way it's being experienced, of course, is locally, contextually influenced. And you can see the whole range of exposure pathways that are involved, from the most obvious and direct, like extreme heat, for example, which kills people during extreme heat exposure, particularly the elderly, but not just the elderly. Effects on labor productivity, so you can't work as much as the temperature increases. Effects on pregnancy, which I'll mention in just a moment. The effects on air quality, for example, wildfires, which increase the level of fine particle air pollution and increase death rates in the days following exposure to wildfire smoke. The effects on water and sanitation, increased flooding, but also reduced rainfall in other parts of the world. Effects on a range of infectious diseases, both vector-borne and other diseases, vectors being like mosquitoes and ticks and so on. And then, of course, the food system, food supply, nutrient quality, and so on. And then on the far right, very difficult to quantify, but these indirect socially mediated effects like increased poverty I've mentioned, population displacement, and probably conflict as well. And this slide shows you how the temperature, the global average temperature of our planet, has diverged from what it would have been if we hadn't had human-induced climate change, which is the orange line. You can see there's fluctuation. But the red line is what's happening now, and we're now about 1.2 degrees global average temperature. Of course, some parts of the planet heated up much more than that. On the right side of the slide, you can see a recent study done by many of my colleagues at the London School. It's actually a global collaboration, where they got data from over 40 countries, over 700 sites. And they looked at how heat-related deaths had evolved over time to see whether they could attribute some of the heat-related deaths to climate change, to human-induced climate change. In other words, to distinguish between natural variability and human-induced climate change. And they estimated about 1/3 of heat-related deaths from these countries could be attributed to human-induced climate change. And increasingly, and we'll be working with Dan Mitchell and others, thanks to the Wellcome Trust funding, we'll be looking at the attribution of a whole range of health impacts to human-induced climate change. But the map also shows you big grey areas, and those are gaps in the data where we don't have good data. We believe that climate change is having an impact, but we can't prove it on health yet. But this is some work we're doing in West Africa, in the Gambia, led by my colleagues there. And you can see them actually in the field measuring the wet bulb globe temperature. And they're working with pregnant subsistence farmers. And on the right, you can see how, as women are exposed to increasingly high temperatures, in order to keep their core body temperature at a physiological level, they divert more blood to the skin. And in doing that, we believe that they deprive the placenta of what much needed blood supply, and that endangers the fetus. So on the left side of the slide, you can see how the fetal heart rate goes up in relation to the amount of heat that pregnant farmers are exposed to. And these are women that don't have a choice whether to go out to work. They have to work in order to feed their families. So we're documenting actual effects now of these extreme heat exposures. We also know that it increases the risk of premature labor and stillbirth as well. So it's having an effect on pregnant women and their offspring. We've also demonstrated that it has effects on infant growth. So it actually affects the growth of infants, extreme heat, as well as the effects on nutrition. We know that drought's increasing in many parts of the world. This is one estimate. This big drought in the Horn of Africa, about 100 times more likely as a result of climate change. Over 4 million people in need of humanitarian assistance, and effects on many health pathways that I don't have time to go into detail, but nutrition, air pollution, wildfires, of course, extreme heat, infectious diseases of various kinds, including water-transmitted diseases, waterborne diseases of various kinds, and effects also on mental health as well as physical health. This slide just reminds us that many vector-borne diseases are affected. It shows you what's happened to 2 common mosquito vectors that transmit dengue, very, very common vector-borne disease around the world, very nasty infection with a mortality rate of perhaps 5%. And you can see how their ability to transmit the infection, they're called the vectorial capacity, has gone up in recent decades as a result of climate change. So it's one of the factors that's causing the spread of dengue around the world. But I mentioned also zoonotic diseases, and what we're seeing here is very likely an increase in these zoonotic diseases, of which COVID is one example. I'm not saying COVID was due to climate change, I'm sure it wasn't, but these are the kind of diseases that are called zoonotic, because they're transmitted from animals into humans. And this is a nice study by Carlson and colleagues showing how land use change and climate change will interact in decades to come. As land is deforested, as climate change increases, that forces animals and humans more closely together. Wild animals with domestic animals, and then animals with humans, particularly when they overlap with urbanization. And the purple area shows you where the urbanization overlaps with this increasing transmission of these zoonotic diseases. So we believe they will increase. Nutrition, the map here shows you where crop yields are likely to decrease in coming years. You can see there are some green areas as well in the northern hemisphere, but we don't know how long that will go on. And the tragic war in Ukraine has also showed us that we can't depend on crops being exported from some temperate climates to around the world. And on the left side of the slide, you can see how the climate and agricultural models show us that as the century goes on, the red and the orange bars increase, and that means that crop yields are going to decline even further. So changes in crop availability, effects on livestock, and also effects on the nutrient quality of crops. And we know also that the food system is the big driver of environmental unsustainability. It's about 30% of greenhouse gases, depending exactly what you include. But this slide also shows us that it's a major driver of biodiversity loss. In fact, over 95% of mammal biodiversity is occupied by domestic animals. So we've squeezed wild animals into a very tiny percentage of total mammalian biomass. And even bird biodiversity, about 70% is domestic poultry, essentially. So humans are dominating the ecosystem for their own purposes to grow food. And we know, of course, that feeding crops to animals is inherently also inefficient because you get conversion inefficiencies. So big impacts on nutrition going forward. But also, of course, as I mentioned, it's not just physical health, it's also mental health. And we're seeing increasing mental disorders after extreme events like floods, droughts, wildfires, and so on. If you follow people up for a year afterwards, you find pervasive effects on mental health. And this concept of solastalgia, which is the grief caused by environmental change, So if your community is forced to relocate because your village is no longer habitable, for example, like in the Arctic, then you experience this solastalgia. And also on this slide, you can see how many young people around the world are experiencing climate anxiety. Not just trivial anxiety, but nearly 50% of them said the anxiety was so severe that it was affecting their functioning. So this is already having effect on the health of young people. So let me turn towards a more positive conclusion. What do we need to do about it? Well, we need to do two things. One is we have to adapt to the changes that we cannot prevent because they're already with us. And that means better early warning systems, for example, more flood protection, infrastructure upgrades, more resilient food systems, more resilient healthcare systems, and so on. But we also need to mitigate. We need to cut emissions. We need to cut some of these damaging activities that are damaging our ecosystems, damaging nature, and therefore undermining our health for the future and now. And we need to integrate these policies. And one example of the integration is what's called nature-based solutions. Nature-based solutions are the employment of nature as a way of helping us to adapt to and to mitigate many of these environmental changes that are occurring. And what I mean by nature-based solutions is that these are solutions that should achieve multiple objectives in an integrated way. They should protect and enhance biodiversity. And very importantly, they should be culturally appropriate. So they should sustain the rights of indigenous people, not displace them from their land, and build on indigenous knowledge, because often indigenous people have the greatest knowledge about how to protect the local ecosystems. And the scientific community has not been very good at listening to indigenous knowledge, but increasingly many people now are working to integrate conventional scientific knowledge with indigenous knowledge. It's an important way forward. So nature-based solutions can obviously help to cool cities. Green up space in cities, for example, can help to cool cities, as well as providing benefits for mental health. But there are also big benefits to moving towards more sustainable ways of living. For example, as we phase out fossil fuels, we also reduce air pollution. Our recent estimates suggest about 5 million premature deaths from air pollution, mainly fine particles that we're all breathing in at the moment. 98% of the world's population is breathing air which is above the WHO recommended limits. So obviously we're not heavily polluted here, but we are breathing air that will be higher than those limits. And this increases the risk of heart disease and stroke and many other conditions. About 5 million deaths have been linked to physical inactivity, conditions like diabetes, heart disease, stroke, and so on. So again, the best way of getting people moving is not universal gym membership. If you're like me, you can't keep it up. The only way I really get exercise is by walking and cycling in my day-to-day life. So having more sustainable transport systems that are also better for our health. And then finally, the food system. There was another commission called the Eat Lancet Commission, which pioneered this idea of a planetary health diet. Some people didn't like it, it was quite a radical proposal, but I think overall they were in the right direction. And they suggested over 10 million premature deaths a year could be prevented by mid-century by moving towards a diet that was more consumption, greater consumption of fruit and vegetables, nuts and seeds, plant-based foods, and lower consumption of animal products, at least in high-consuming populations. We're obviously not saying that in low-income countries you need to reduce animal products. That's a different matter. This just gives you an idea about where the air pollution deaths would occur that we could prevent by moving towards renewable energy. And you can see the map at the top shows you where all the air pollution deaths are, not all of them due to fossil fuels, but a lot of them are. The middle map shows you what would happen if we could take out all the fossil fuels and stop burning them. And you can see that the air pollution becomes much less of a public health problem in many parts of the world, Asia, Europe, North America, parts of Latin America as well. And the bottom map shows you if we could take out all the human-induced emissions that get out into the ambient air, for example, burning solid fuels in houses, for example, which is very common in low-income countries, we could then, air pollution would not be a major public health problem in many parts of the planet, only in those parts of the planet near the Sahara and the Middle East and so on. So big benefits to human health. And we've created an evidence bank through the work we're doing funded by the Wellcome Trust, the Pathfinder Initiative, which summarizes a lot of this evidence, which you can just download if you're interested. A lot of the evidence we found was modeled evidence, but what's really important is to assess what happens when you try to implement change at scale. Because that's where you really learn about the barriers to change and what's feasible and what isn't. So we also tried to collect case studies of implemented actions, and we found not as many as we'd hoped, about 30 of them, quite diverse, and I just want to give you a few examples in closing. This is one example of what happens in the US when they moved from coal and natural gas to renewables in parts of the US, obviously not the whole of the US. And they had these renewable energy portfolio standards which they implemented. And that took out about 150 million tons of CO2 in 1 year alone, but also prevented thousands of premature deaths. And obviously, if that was in China, if it was in countries where they burn a lot of coal in very old power stations, those prevented deaths would be even greater. In Buenos Aires in Argentina, they had a bike scheme called Más Bicis Menos Emisiones, and they promoted cycle travel, safe cycle travel, and they were able to demonstrate big reductions in CO2 emissions as a result of less private car use, but also a big increase in bicycle trips and reduce death rates from injuries and accidents. And if they'd have factored in also the benefits of more physical activity, they would have had even greater health benefits. We also came across this very interesting study in Australia, which was the only randomized trial that we found, where they randomized 500 low-income households to have the intervention before the winter and 500 after the winter. And what they found was that the upgrades reduced the need to burn fossil fuels. They also made the homes warmer. People felt better, their mental health improved, they felt less breathless, and very strikingly, it actually reduced the pressure on the healthcare system. So for every Australian dollar they spent on the upgrading of the houses, they saved $9 for the healthcare system, which I found very surprising, but very gratifying result. So some of these interventions can be very cost effective, but of course the benefits may not accrue to the housing minister, benefits may accrue to the health minister, for example, and that's a challenge for governance. And my final case study is in Indonesia. It's a very nice piece of work by an NGO called Health in Harmony. And what they did was they tried to investigate the reasons for deforestation in this national park in Indonesia. And they did what they practiced something called radical listening. So instead of telling people, don't deforest, they asked them, why are you deforesting? Why do you need to do this? And what people said to them was, the reason we need to deforest is we need money to buy healthcare for our kids. And so they said, well, supposing we provided affordable healthcare, how would that change your behavior? And they said, well, let's see. So they decided to work together. And they put in a clinic into this community. And they were able to document nearly 30,000 people had better access to healthcare. Infant mortality declined. And they were able to document that 90% fewer households were relying on logging. And so a lot of above ground carbon loss was saved. And they were able to demonstrate an effect compared with control areas. So it was quite a convincing piece of work. And it seemed to me the way we should be going. It's about you have to listen to people and understand why they're undertaking certain activities. And then finally, the food system. And this is, it's difficult to do intervention trials, but this is a kind of real-life experiment, if you like. It's done by my colleague Pauline Schielbeek at the London School. And what she did was to look at people who were adhering to our Eat Well guide recommendations, which are kind of national dietary recommendations, which are about eating more plant-based foods, less red meat, less processed meat, and so on. And what she found was that those people who were adhering to this diet, particularly completely voluntarily, had a 7% reduced risk of mortality from heart disease and so on, and also 30% lower dietary greenhouse gas emissions, both CO2 and methane. So there's lots of people in the community already doing this purely voluntarily, this shows you that it is possible to change behavior in a virtuous way. And then finally, the healthcare system itself. We tend to forget the healthcare system is also a source of greenhouse gas emissions. If the healthcare system was a country, it would be the 5th biggest emitter on the planet, about 5% of greenhouse gas emissions. In the US, it's nearly 10% of emissions. So in providing health care, we're also contributing to some of the environmental damage that we're seeing. And this is why many, many health professionals now are becoming mobilized to reduce the environmental footprint of the healthcare system. And the NHS has a big program to decarbonize the NHS, create a more resilient, more climate resilient and lower carbon NHS, which you can see on the right side. And the important take-home message here is that many of the emissions, about 60% of them, are what we call scope 3 emissions. So they're in supply chains. It's not just about decarbonising the hospitals and health centres. It's about the supply chain. So you have to work with the pharmaceutical industry, medical equipment industry, and other suppliers in order to decarbonise those industries. And internationally, the World Health Organization has created this WHO alliance, which is bringing together countries, many countries around the world, to work together to create net zero and climate resilient health systems. So I've given you a very big picture, a rapid tour of this whole complex area of planetary health, this interrelationship between this multiplicity of planetary boundaries and human health. There's still a lot that we don't understand, but we know enough to act. There's a lot of things that we can do now. We have to act with ambition, but also we have to be self-critical and evaluate what we're doing to ensure that we do have the desired impact. And we identified 3 key challenges that had to be met in order to advance the planetary health agenda. The first of these was the imagination challenge, and that is like a conceptual challenge. At the moment, our societies are focused on consumption and focus on economic growth. And of course, you do sometimes need economic growth, particularly when politicians crash the economy. You need to grow it again to overcome some of those negative effects. But it has to be growth with a purpose, and growth will always be finite. So we have to understand how to have a soft landing and how to create growth within planetary boundaries. And the growth should be in human well-being, in human health, within planetary boundaries. We need, of course, to develop better knowledge systems, and that can't be done by any single discipline, and that's why this event today is so important. And I think the Cabot Centre exemplifies really the need for transdisciplinary work. No single discipline can solve these problems. We have to work across the sciences and the arts and humanities as well to work together to craft these potential solutions. And finally, we have to address the implementation challenges, because we already know a lot of what we have to do, but we're not doing it. And the reason for that, of course, we can debate, but there are big vested interests that are opposing change, probably lobbying our governments to prevent change at the necessary speed and scale. So we will have to overcome these powerful interests in order to implement change at the necessary speed and scale. I'll leave you with that thought. Thank you very much for listening. Thank you.
Thank you very much, Andy, for that tour de force. My name's Rachael Gooberman-Hill. I'm Professor of Health and Anthropology here at the university, and it's my pleasure to thank Andy, first of all, and then invite our panellists to come and join us onto the stage, and we're going to have what I think will be a lively and engaging panel discussion about the issues that Andy's put into our minds so far. So let me invite the panellists to join us. Thank you. So we've got about 40 minutes now for a really fabulous discussion. And what I'd like to do first of all is to invite our panel members, who are all experts in their field and who we're delighted to welcome to Bristol, to introduce themselves. So Gail, may I invite you first?
Yes. Hello everyone. A pleasure to be here. My name is Gail Marzetti, and I'm the Director of Science, Research and Evidence in the Department of Health and Social Care. And with that role comes another role, which is the Deputy Chief Executive of the National Institute for Health and Care Research, which provides all the research for the NHS, the wider health and care system. But I'm not a health person by background. I'm an agricultural economist and have spent much of my career working on food supply systems, particularly overseas. So I've particularly specialised in food for refugee camps and working with refugee populations. So I worked for a long time in the war in Mozambique and then in the post-conflict period. I've also worked in Nepal for 4 years, including during the time of the earthquake and when many people were displaced, not because of climate change, but because of a natural disaster. I've worked in Myanmar and during the Rohingya crisis and the movement of people there to Bangladesh, and also for 3 years in the Amazon rainforest in Brazil, doing research on tropical rainforest and the Varzeia reconstruction. Thanks.
And Modi.
Thank you for the invitation to be here. I'm Mwatsama. I'm Head of Capacity and Field Development at the Wellcome Trust. So it's a philanthropic foundation which funds science to help solve some of the world's global challenges. We don't just fund science, we also fund activities to ensure that that science actually leads to a real world change and improvements in people's health through things like supporting communications, advocacy, policy and influencing activities, community engagement activities as well. I have a background in food systems and public health. I studied nutrition way back when I was at university in public health nutrition, and mainly spent my career before coming to Wellcome in policy development and advocacy organisations, really working on the prevention of non-communicable diseases. So I've always worked at the evidence to policy action interface. I moved into, I guess, the climate change area, which is now where I'm working through the links between food systems, climate change and health as outlined by Andy earlier. At Wellcome, my current role is focused on, as I said, capacity and field development, and really what that means is helping to grow the global community of researchers who are able to undertake research at the intersection between climate change and health. It's a relatively new field. Understanding and awareness that climate change has health implications is still low and needs to grow, and we need more action across societies as a whole. So my role really is about helping to build a field of researchers who are able to undertake that research, but also support activities which can help the public broadly, whether it's individuals, people who read the media, decision makers in government or the private sector, really be able to use and understand and use the evidence to help put health at the heart of climate action. And I have a big focus within my team on reducing the inequalities between skills and knowledge in the global north versus developing countries. So a lot of the investments are focused on building capacity in developing countries.
Thank you. And Federico.
Hello, good afternoon. My name is Federico Costa. I am a professor in epidemiology at the Federal University of Bahia, which is in Brazil, northeast of South America. Because of that, my accent. My focus is in urban health, specifically in informal communities, vulnerable communities. When we work, my team work with zoonotic diseases, like rat-borne diseases, mosquitoes-borne diseases, but more broadly, together with the residents for those communities, we work together on identifying, implementing, and evaluating interventions that can prevent the transmission of those diseases, but also improving the general quality of life, because for those communities, infectious disease is really not a priority. We need to deal with others priorities like violence, racism, and other factors. In order to improve the quality of life in those communities. I have also served as consultant for WHO on responses for climatic disasters, for events, extreme climatic events in the Bahamas, in Nicaragua, in Iran, and in a couple of other settings, also in response and prevention to potential future outbreaks after natural disasters.
Thank you. And Chantelle.
Hi everyone, I'm Chantelle Lindsay. Thank you so much for having me here. I am a wildlife conservationist and natural history presenter with a children's TV show, so I'll start with London Wildlife Trust first. So I'm currently working with London Wildlife Trust and have done since my first job in the wildlife conservation sector. And I came through a traineeship called Keeping It Wild, which was designed to bring more young people into the sector, more young people from underrepresented backgrounds within the sector, because as a lot of us know, it's the second least diverse, ethnically diverse sector in the UK after agriculture. And it also had an emphasis on bringing in young people from lower economic backgrounds, socio-economic backgrounds, and young people with disabilities. And so that's how I started my first job into the sector, having studied animal behaviour and wildlife conservation. I worked on a project called the Great North Wood Project, which was a woodland restoration and community engagement project based in South London. And now I'm working as a project coordinator on the Nature in Mind project, which is a partnership between East London Foundation Trust and NHS CAMS, based in the London Borough of Newham. And it's working to address the waiting lists that have occurred post-COVID mostly, but it makes it so that the lower risk cases are having to wait a lot longer. So we are providing wild wellbeing, we call it, wild wellbeing sessions for these young people in order for them to wait well before they get their intervention. So it's a pilot project, and it's our first, between London Wildlife Trust, it's our first partnership with NHS. And then I also am a natural history presenter and have a show on CBeebies called Teeny Tiny Creatures with Chantelle and Rory, which promotes the amazingness of our teeny tiny creatures that we have in the UK, what they do for our planet, how cool they are, and what we can do to help them and our planet, basically.
Thank you so much, Chantelle. We love teeny tiny creatures. We think it's fabulous. Thank you for that. Andy, you may feel that we've already met you and been introduced to you, but is there anything you'd like to add, now having heard who the panel are?
Well, I don't think so. I mean, I think they're wonderful panelists. And just to sort of emphasize really that, I mean, I started off obviously in human health, but I see all of these different strands as being interconnected. And I think one of the challenges is that in creating health professionals, we often start from a very narrow base. And I think increasingly we need to think in the training of health professionals, both at the undergraduate and the postgraduate levels, how we can integrate some of these concepts into the training. And also thinking about a wider range of professionals as health professionals. And I was rather struck by the fact you didn't consider yourself a health professional, but when I was listening to you, I thought, wow, you're a health professional, you probably have more impact than most health professionals. So in the end, everyone's a health professional.
That's a really good thought, and it's a great takeaway for our medical school here to think about. I think so, Andy. Thank you. So folks, the way in which we thought we'd run this panel discussion would be to bring to the panel some questions that have been submitted in advance. We've got a heap of questions in the door by email. And that then will hopefully give you some time to think about what questions you'd like to put to our expert panellists. So hopefully some of the opening questions that have been submitted in advance will give you the creative juices that you might find helpful to think about your questions. So we'll do some questions that were submitted in advance, and then we're going to have some roving microphones out to the floor. So quite a few of the questions that came in advance were about the actions that we can take, the actions to preserve planetary health and the actions to move forward. And some of the questions were also about what strategies we might be missing, I guess, as a global community of people wanting to make a difference. So, Andy, can I turn to you first? What would be your reflections on actions needed and what we're not doing?
Well, I always try to resist just giving one thing because everything's a system and it's all interconnected. But certainly looking ahead to COP29, which will be on us in a few weeks, the thing that's very striking there is the absence of a clear commitment to a fossil fuel phase out. And I suppose that is an absolute priority, that we need to keep that kind of vision very much in mind. And of course there are major financial interests opposing that, but at the same time it has to happen. So we have to keep making that argument, I think, and also emphasizing the health benefits. In the UK, I think we've been particularly weak on the food system. Okay. I believe that, there's a lot, maybe Marty wants to say something about that, but I do think we've been particularly weak on food system policies because they're so important for public health and also the health of our environment. But maybe we can come back to that in the discussion.
Thank you. Modi, would you like to come in?
Yeah, sure. Thanks for that, Andy. I completely agree. Food systems are a real important priority. As Andy outlined with the Eat Lancet diet, in places like the UK, we roughly need to halve our consumption of animal-sourced foods like meat and dairy, and double our consumption of plant-based foods like beans, pulses, fruits and vegetables. So our diets are currently way off where they should be. There's a variety of barriers to that, and so I think we need to start off with leadership from government. So things like shifting agricultural subsidies, which at the moment the majority do go into livestock production as opposed to fruit and vegetables, would be a good start, as well as I think people's general awareness of healthy eating is good. It's the application that makes it kind of more tricky. So, we're funding studies into some of the solutions that could be needed. As an example, we often rely a lot on convenience foods, especially if people are on low incomes, they have multiple jobs, they don't have time to cook. So, one example is how can we look at increasing the plant-based component of foods that people might eat when they're on their go, or when they're buying them to make at home, reducing the amount of chicken and meat in those kinds of products, for example, or when people are eating out. So I'd say starting off with the food systems would be a good place to start. And one other area I would highlight is short-lived climate pollutants, very briefly, which have a much higher global warming potential than carbon dioxide, and there hasn't necessarily been enough of a focus on reducing those. So things like methane and benzene, the levels need to be come down very quickly.
Thank you. Perhaps we'll come back to planetary health diet in a few minutes. There was a number of questions from the audience in advance about planetary health diet and what that means and what the impact of that might be. Would anyone else like to come in on actions and strategies that we might be missing? Federico.
Yeah, I was also thinking in complementing that and changing a little bit the area. I'm thinking tropical areas from what we call low middle income countries. The importance of having initiatives to improve the biodiversity and green spaces in urban areas, which are almost inexistent, especially in informal settings, because all of the consequences that Dr. Haines already mentioned. I know it's more a resilience strategy, but it's really important and something that we need to improve if we want to be resilient to those changes.
Great. So we've got biodiversity, we've got planetary health diet, we've got thinking about how we reduce emissions, all sorts of things in the mix there. Chantelle, anything you'd like to add?
Yeah, I think it's definitely getting a lot more traction now, but really investing in community-driven efforts. Okay. The communities that are on the ground, the locals, they know their areas best. And so a lot of people are doing work that they don't even think is, super impactful. But the big organisations are now looking to them, and wanting that knowledge, and you have to kind of invest, and you have to empower and allow people to lead. So I think, investment in community-driven projects and grassroots projects.
I think that's fascinating. We heard from Andy, didn't we, about the active listening project in Indonesia and what a difference it made to be engaged and to hear why people were doing things in the way that they were. So is that linking in, Andy, with what you were thinking about there?
Yeah, absolutely. I think this importance of listening is absolutely vital, and rather than just going in and blaming people for activities that maybe they don't have much choice, and so we have to understand the roots of these behaviours. And also have to work with communities, and as I mentioned, indigenous communities, but really all communities, to help them fashion the kind of responses that really make sense in their local context. At the same time, we can't let central government completely off the hook either, because they need to send the right kind of policy signals. You need to price things properly. If you don't have adequate carbon pricing, then of course you won't phase out fossil fuels. So it's a combination of national government policies and then bottom-up policies engaging communities.
Yeah, so lots in the mix. Gail, can I invite you in?
Yeah, so I think for me a real key area that we haven't discussed is addressing inequalities. Yeah. So addressing inequalities globally, but also within our own country. And certainly that is something which I would really like to see in my tenure of being the head of the National Institute of Health and Care, is how can we really take health research to the poorest people. That's where you get your biggest gains, but we know that deprivation and age drive ill health, and we know that we can resolve it because we've resolved it for many others who have much higher life expectancies. And it's the same globally as well. It is such an unfair world. And I think, as Andy said, many people don't really have the choice. You have to cut down that tree if you're going to live today, because you can't look forward for tomorrow. So it's coming up with some sort of strategies of how can you help people have a bit more security and investment in the future, so they're not destroying the environment or the climate, or doing things that are adverse to their long-term future, because they just got no choice, because they've just got to cope with the situation they're in at the moment.
Thank you. Shall we turn to open the floor? Shall we see what questions are coming from the audience? Folks, if you have a question that you'd like to put to any of the panellists, I invite you now to raise your hands, and we'll send roving microphones your way. And we might bring one or two questions in at the same time. So we have a question at the front here, first of all.
Yeah, it's a fascinating discussion. It's come up several times in terms of the recognition of the scale of the problem and the need to act quickly, and the benefits if one does act. But I'm taken by Mark Carney in a brief lecture who spoke about tragedy of the futures, in the fact that the politicians of today making a decision often get the negativity associated with the cost of that decision, and it's the future leaders that reap the benefits. And that seems a huge challenge to overcome for political leaders making these big choices.
Thank you. It's a big question, tragedy of the future. Andy?
Yeah, I'll have a quick go. It's a massive issue, of course, but it's the reason why we emphasize these near-term co-benefits of action. Because when I mentioned things like the improvements in health from reduced air pollution, increased physical activity, better diets, these are near-term benefits. They'll be experienced in a few years. The benefits of reducing dangerous climate change will play out over decades, centuries, and so on. And so I think it is really important to put in place policies which will show some tangible benefits in the near term. And that seems to me to be a crucial challenge of policy design and implementation. And also to sell that to the public, because one of the problems you have is that a lot of misinformation. I don't know if you remember the furor a few months ago around the 15-minute city. The 15-minute city was an idea to put people's essential services within 15 minutes of their house, which seems an eminently good idea. It was reconfigured by some people to say this is an attack on our liberty. What they were going to be doing is preventing us from going more than 15 minutes from our home, which is obviously complete nonsense. But it can be easily weaponized. And so you have to really understand how the kind of message is going to be twisted and what can be done to make sure that or minimize the risk of that actually happening. So I think there's a number of challenges that we need to confront, but the near-term benefits and tackling mis and disinformation are crucial issues.
Thank you. And Modi, you'd like to come in?
Yeah, the other thing I would add to that is also framing the benefits of action in terms of the benefits to children and future generations. I think most people actually care about children and their future, and they'll always worry about that, whether it's their own children or just society more generally. And so this is a perennial challenge we face in problems like climate change, non-communicable diseases, which have shared common drivers. In terms of building that political and public support, ultimately it's people who vote in for the politicians. And so actually thinking about, yes, there's the immediate benefits to people today, which will have benefits to, costs to the NHS and that kind of thing. And there's also thinking about what about the children's future. And I haven't necessarily come across, there is some thinking around that in climate change, what are the benefits for the future, but we could perhaps use more of that framing as well in this area.
Yes, and whilst we're worrying about the future, I just wanted to look at the past a little bit, because I can remember the time where anything about climate change was seen to be a bit of a sort of loony lefty subject. You were marginalised. It really wasn't accepted. And so what I so appreciate now is to see that this is a central issue. The evidence base is absolutely compelling, and it's something that everybody is taking seriously. So although sometimes in the short term we think we can't change things, from the 80s to here, I think the whole issue about concern about the climate has really changed from being marginal to being central. I know that there's still a lot to do, but it does feel like the world can change.
So that's a really nice reminder about how we communicate the evidence and the evidence being compelling. And there's a great reminder there about thinking about the near term and the far-reaching futures and how we communicate benefit for the future. But we have some questions from the audience in advance about how we can best communicate the evidence and communicate what's needed. So what do you as a panel think that we need to do better or differently? Chantelle?
Yeah. So I remember in university when I was learning about animal behaviour and wildlife conservation, and it was like this huge no-no to say anything that was really cute or to anthropomorphise anything. And I know that's, it's a contentious subject, but that's where the emotion comes in, that's where the connection comes in. And so when you're thinking about communicating complex issues that can be really overwhelming and really daunting, it's really about trying to get that emotional connect with your audience, knowing what matters to them, and making it a lot less, it just seems so big, especially for children, You were saying about children being the future. Of course they are, and there's a lot of rise in eco-anxiety, and really they're so much more knowledgeable and can take on so much more information than we think they can, but it just has to be digestible and also solution-driven. And hope, I think, within younger generations is sometimes a lot more powerful than the doom and gloom kind of narratives that we've maybe seen in the past. And also having young people just being themselves. I mean, amongst social media, you look at TikTok and maybe platforms like Instagram as maybe trivial and things like that, but they're really powerful for communicating these kinds of issues. And a lot of the kind of influencers that that a lot of young people look up to at the moment and see are all talking, well, a lot of them are talking about sustainability, a lot of them are talking about environment. So that kind of concept of everything being connected and communicating within what people care about. So if it's fashion that people care about, you can talk about sustainability and things like that. And I think CBeebies do it quite well as well. I thought I was just going to be a nature nerd through and through, maybe in a lab or something like that. So finding myself singing, dancing on stage, but talking about, for example, it was a prom for BBC. It was classical music, so children's first introduction to music, but at the same time we were talking about the perils that are happening within ocean conservation. And the one that we did recently was a wildlife jamboree, and it was inviting all these animals. And so within this kind of huge show, you had these really beautiful, powerful messages that were made digestible for the audience.
I'm seeing recognition from the panel members here. Yeah. Okay.
Yeah, just maybe complementing that. That's great response. And in my experience, I'm working with in communities where usually the information came from places where it's not trust. For us, it's very important that information is being passed by people that is trusted. For example, community leaders, persons that are important for the community. And as you mentioned, need to be very, very, because of the high priorities in a diverse range of subjects, need to be solution-based. And the use of technology for the young people has been very, very important. And not just as kind of social media, but also for this interaction with apps and using gamifications where people become connected and they can map their own communities and promote solutions. So a lot of the interventions that we are doing now in Brazil are based on apps that are collaborative maps, as you mentioned, and where the community can identify not only the problems, but also all the opportunities that can do to solve that community and improve the quality.
Ready.
And I can add some examples from Wellcome in this space to really ensure that the science we fund gets communicated to different audiences. As Chantelle was saying, you really need to know your audiences and use a variety of different media. So some of the examples that we've used are, for instance, running sessions with people who produce popular soaps, for example, medical soaps, to connect them with scientists who can tell them about the evidence of climate change and health. And then also generate with them potential stories that they could incorporate into the TV shows that they're doing to communicate to the masses. But that's a kind of more subtle way of doing it, where people don't necessarily are watching their favorite soap or TV program, and there'll be climate and health messaging coming in indirectly. And then there's also approaches we use. So for instance, we commissioned a film company to produce short stories, really filming people who are facing the brunt of climate change in different parts of the world, to be able to tell their stories. And then that kind of film was taken to, for instance, the Climate Change COP, which we hosted in Glasgow a couple of years, and it's been shown in other fora, where you were bringing people who wouldn't normally attend those kind of fora, but you were bringing them into them to be able to tell their stories directly to the decision makers of the world, to kind of share how they were being impacted. So you do need a variety of different tools and approaches, tackling different audiences and knowing who they are, and speaking to that emotional bit as well is really key.
Add to that, yeah. Actually, that reminded me. So there's a group called Flock Together, which is a birding group, which was originally for people of colour, but it's expanded now. And it's gone global and things like that. And I went to an event with them, and I met a girl who was a writer for the Popular EastEnders soap, which of course is nationwide and really well known. And so she was an avid birder, met her, and then a few months later I started watching EastEnders again, and they've got this, I'm not sure if anyone's watching it, but they've got this storyline about bird watching just going throughout it, and you kind of think, oh my goodness, like you're watching EastEnders, there's all this drama going down and all these things are happening. But there's this beautiful thread about how bird watching can help boost mental health. And so people who are just sat at home, you know, watching this soap, not expecting that, are watching the benefits of bird watching unfold on their screen.
I'm hearing recognition in the audience, actually, yeah? Anybody following that in EastEnders, yeah? Seeing that golden thread. That's a lovely example. Should we see now if there's any more questions from the floor? Yes. There's a lady here in the front.
Hello, it's been a fantastic evening so far. I'm from the medical school here in Bristol, and climate and health and sustainability is really close to our hearts here, as is AI and health, with Home of Inspired AI as well. And I have this conundrum going around in my mind in that I can see a million uses of AI in everything we do in biomedical research and health. So I look at the sustainability and the impact of ChatGPT search using 30 times the amount of energy. So I just wondered if the panel had any tips for us around how we have so many opportunities to use AI, but how do you think we can manage the impact of that in terms of sustainability? Okay,
AI, exciting, but not without environmental impact. Big new supercomputer here at Bristol, big opportunity. Would anyone like to comment?
Well, I suppose it depends what's powering the computer, and if it's a coal power station, it's one thing, but if it's renewable energy, it's another. I mean, I certainly think AI in health has got a huge potential. It's the fact that machine learning means that you can do things quicker and more accurately, particularly for diagnosis. So people can it helps prevention, which is so important. So I think the benefits are enormous, and I think yes, at the moment that uses a lot. I can remember still when computers were massive actually, and you had to put cards into them. So hopefully as science and as technology advances, they will use less energy. But at the moment, it will depend what the source of your energy is, I think.
Thank you. Andy?
Yeah, I mean, I agree. I think, like many advances, there are both pros and cons, but certainly the energy requirements are large and growing, but we're also seeing some big advantages. So working with colleagues in Germany, we're using machine learning approaches to try to synthesize a rapidly growing literature, because, we used to do these things called systematic reviews, which you're very familiar with in the health field, where you try to look at all the evidence on a particular topic to reduce bias as much as possible. And that's a great way forward. But the problem is the literature is increasing very, very rapidly. And that's very true in climate change and health as well. It's growing by about 14% a year. And you can imagine, that's probably accelerating. So what we're doing is trying to use machine learning to try and cut out some of the time that is involved, to try and screen thousands of papers that may be relevant, and weed out the ones that might be particularly relevant to the question we're asking. Of course, you have to train the machine learning algorithms, but if you do that, it does seem like there are significant benefits. I think the other potential, well, there are many, many positive applications, but another one is combating mis and disinformation. So there's recently been some studies, a nice paper published in Science actually, showing how AI approaches can reduce people's belief in conspiracy theories by presenting evidence to them in a more compelling way and actually counteracting some of the very specific beliefs that arise from conspiracy theories. And they seem to have almost like an immunization effect. So it actually reduced not just their belief in that particular conspiracy theory, but in conspiracy theories more generally. So I think one could see that there might be AI applications that could be used for ill or good, but obviously we're focusing very much on the potentially beneficial applications.
Lots there, misinformation, disinformation, building trust in the evidence, communicating the evidence well. Any more thoughts from the panel about AI?
Well, overcoming misinformation is especially in the climate and health area, is extremely important. And I think it goes back to what we were just talking about with communicators and communicating with trust and having people from your community or influencers that you know, doing that bit to overcome the misinformation. But it's extremely important that we get on top of this, because people can go down a rabbit hole quite quickly, and it's a very dangerous thing.
Yeah, I completely agree with all that. And I mean, just to add another example of the practical application of AI, there was a systematic review that was undertaken in 2021 of the whole climate and health evidence base, identified about 16,000 studies. Andy, you were probably a co-author on that. But essentially, this wouldn't have been possible without machine learning. And so it did a very rapid review of all the literature and gave us a picture of actually where are the gaps. And essentially what it found was that 85% of the current studies in this space are describing the problem. So looking at what are the impacts of climate change on people's health. And only 50% of the evidence base at the moment is looking at the solutions around how can you effectively mitigate against climate change in ways that have health co-benefits, how can you adapt to climate change in ways that protect health. So, whilst we have some ideas of what needs to happen, certainly around reducing greenhouse gas emissions, it has shown that actually some of the adaptation solutions and what works where, we don't really know what we can do now. And we're in a situation where the WHO, for instance, doesn't have best buys for climate change and health in the way it has for other fields like HIV or non-communicable diseases, just because the evidence base isn't yet there. Another example of the gaps that this study has shown is that most of the literature, over 80%, is focused on rich countries, 20% is focused on developing regions and undertaken by researchers in those regions, and yet those are the parts of the world that are most affected by climate change. So there are positive effects of these kinds of tools, because that kind of information is being used to guide the investments of Wellcome Trust, and we have a £40 billion endowment, so we have a lot of resources to put into tackling the world's health challenges. And so that's another example of where machine learning is helping to identify where are the gaps and where can those investments be, and then we can then also bring along some of our other investment philanthropic spheres to guide them where the investments are needed in climate change. So I think it has a lot of positives. Obviously the generation of that data will have had its greenhouse gas emissions linked to it, but I think you're absolutely right. Thinking about renewables and powering up those machines with renewables is kind of the way to go. And then that increased demand for renewables can then increase investment in them and encourage more people to switch, bring down the prices as well.
Thank you so much. Shall we turn back to the audience and see what else comes in? There was a very patient man on the aisle near the front, and then there was a question further back.
Thank you very much. One of the things referred to in the talk was the people who pay and the people who benefit aren't always the same. So I've got a question. Have you got practical examples of how to persuade those who need to make the investments and those who are going to get the benefits, whether short-term or long-term, to link up? What solutions are there to that we can use, or examples that we can use to show that? Including the vested interests of the rich. How can we persuade them that it's right to have a transition that takes away their current investments, but switches it to positive?
So a question there about how investment can be, I guess, driven, if I may, and the trade-off between the fact that people who pay might not always be the people who will benefit. So maybe this is a question in the first instance for Modi from Wellcome Trust, if I may, and maybe it'd be interesting to hear Department of Health and Social Care's perspective as well from Gail.
Yeah, you can go first.
You can go first. Oh, well, okay. Well, I don't. Okay, so from an investment perspective, I think we have a big endowment, but then actually, as long as the investments align with our mission, we have to be guided by our mission and our charitable objects. And so that's kind of what will drive our investments. And so we don't necessarily have anything to lose by making those investments. But I think, one reflection I'll have in relation to that question would be, the difference between rich countries where their emissions are highest and they need to actually act, but they're not going to have the biggest impacts of climate change. And I guess tapping into arguments like migration, one of the reasons why there's an increase in migrants coming to a place like the UK is because climate change is increasing insecurity, war, people don't have food, they don't have jobs, and so when you get really desperate, you're ready to risk your life to move to another place where you can actually survive. And so those kinds of security migration arguments, which perhaps they could be a bit racist, but actually making that kind of case can help, can be one of the arguments used to say actually you need to invest in tackling this problem, otherwise it's just gonna increase the problems that you're going to be facing in the country. There are other examples of zoonotic diseases or even COVID, which these days with globalization, these diseases that are going to rise with climate change are going to spread much faster because of global travel. So, there's another health security argument behind actually making the case for investing in that. So those are just a couple of high-level reflections.
So I think to a certain extent it's about social justice and sharing. So I think that's those are important principles, and certainly if you're looking at it through the lens of philanthropists or charities or even the UK aid budget, that's exactly what it's for. And it's also the fact that we're in this interconnected world. I mean, do you remember in COVID, no one's safe until we're all safe. So there could be some benevolent self-interest involved in that. There's also quite an interesting way of looking at government a little bit differently, and the Scottish government certainly do this, and to a certain extent the new government now, which is having mission-driven government where instead of one ministry just having its responsibility in its budget, many others are involved in it. So with the health mission, a lot of the things that need to be delivered, particularly in prevention, are going to come from housing. They're going to come from education. They're going to come from social care. It's much wider than health. And I'm already finding myself being asked as we're looking at the future. What are we going to be delivering to the missions, such as the safer streets or the opportunities for the young? So certainly that sort of cross-cutting way of looking at things means that there's less obvious winners and losers, and in actual fact, if we can all win together, that's the situation that we want to be in.
Andy, would you like to come in?
Yeah, no, I very, very much agree with what's been said, but also just wanted to add that I think there is also a danger in public policy where you do put more of the burden on disadvantaged populations, you get a big pushback, and sometimes it can fuel populism. And we saw that, for example, in France with the Gilets jaunes movement, where essentially poor rural people who had rather polluting vehicles were being told that they couldn't use their vehicles and so on. Maybe that was also behind some of the ULEZ expansion pushback as well. So I think it's really important to ensure that when policies are being designed and implemented, they don't disadvantage people who often have very constrained incomes and haven't necessarily been contributing massively to the climate change problem. But then, of course, we get back to the polluter pays principle, which is a great principle, but often not enacted. So, it isn't really the fossil fuel interests that are paying the full economic cost of climate change. They have very, very cleverly evaded their responsibilities. And so it seems to me this is an issue of political leadership, that ultimately you need the leadership that says, well, we are going to ensure that these powerful interests do pay the costs of the kind of activities that they've been making very large profits on for many, many years. But that requires political leadership, of course, and determination, and also very good communication skills, because you have to communicate that to the wider public. So,
should we turn back to the audience? I know there was a question quite far back on this side over here, and then there's a few more at the front. So.
Hi. Yeah, you almost addressed it then with sort of talking about global justice and politicians. I was just going to ask about war and how interlinked that is with climate change, partially fighting over increasingly scarce resources, but also fighting over power, but then also talking about the actual environmental impact of weapons, of bombs and the creation of them. And sort of was just going to ask about our responsibility as students or lecturers or researchers, and and the university's role within that. I know especially at the University of Bristol we have quite a lot of links to defence companies who are making defence weapons, which are incredibly environmentally damaging, as well as obviously killing people. I just wanted to bring that up as a topic.
Thank you very much for that question. Let's just wrap another question in as well, because we've got a few from over here at the moment, and then we'll turn back to the panel. So there are two here. Maybe let's have the one at the front, and then we'll come back to you after answers.
Some months ago, I went to a discussion in my old department, what used to be zoology. I can't remember the precise subject, but it was either about sustainable economics or something very similar. The same elephant was in that room as this one. There were no economists in that discussion. We've lived for 40 years in the straitjacket of an economic system that does not value the natural world. It sees it only as an asset to be stripped and polluted. How do we crack that problem? And may I ask the audience a question, please? Is there anybody here, is there anybody here from the economics department? Well, there you go, same elephant. Over to you.
Thank you. So let's join those two questions together, and then we'll come back to the floor. So the first question was about social justice, war and conflict. And this actually echoes questions that we received in advance, where people were asking, what are our responsibilities? And in the tragic circumstances of war and conflict, kind of what are the carbon impacts, and what do we need to do? And then the second question was about the important role of economics in understanding our engagement with the natural world of which we are part. I'm paraphrasing very badly there, but hopefully. Valuing the natural world. Thank you. So a couple of really big, important questions there. Thank you from the floor. Would anyone like to come in? Gail and then Chantelle.
So I'm an agricultural economist, so I would say I was an economist. And I completely agree with you that the way that we've looked at natural resources for centuries is that that they're free resources that we can exploit, and that then they will bounce back, and there's no long-term impact. So that the underpinning of that has completely unravelled in the last 5 or 6 decades, and you need to cost them. But even when I was at university, we used to do shadow costing of natural resources and the full economic costing of pollution and the polluted pays and issues like that. And I think as this climate change issue is getting more and more important, those sorts of different ways of thinking about the world are becoming more to the fore. I'm not saying that there's not a long way to go and they need to move forward. And certainly having worked in lots of other countries, it's really interesting because that paradigm of we can exploit natural resources and it's fine is not the underpinning of many other civilizations. And many indigenous peoples knowledge see themselves as caretakers of the earth or custodians for the future generations. So it's a very different way of thinking about and of caring about the earth. And those are all interesting ideas that I think would help us in this discussion.
Yeah, I agree. Obviously, there's a very long way to go. But I think, reframing it and reshaping it in a way where it's benefiting people. For instance, the Nature and Mind project that I work on with Under Wildlife Trust was born from a study that the Wildlife Trust did across the UK about how green social prescribing projects can be scaled up to relieve the economic pressure on the NHS, so that we're not relying on those processes, as you were saying, Andy, and not relying on those chains, and instead valuing the natural world and how that can help to benefit people's mental health, have less pressure on the NHS, and so saving money. And so at first when I saw the paper and it came across, and I think I can't remember quite the title, but it was just so strange to me to see something talking so explicitly about money and the natural world together. And it seemed a little bit crude at first, but when you get down to the crux of it, that's what we need to reframe and change the perspective, and I think see the benefits of nature, to value it, and for people, if that makes sense.
Thank you. Andy?
Well, just to also respond to the earlier point about conflict, and we do one estimate of the greenhouse gas emissions from the sort of military industrial complex, if I can put it that way, is about 5.5%. I think that's a big underestimate, actually. But that would even put it, well above aviation and so on. So it is a very significant contributor. And if you take into account some of the indirect effects, it's probably substantially more. But I think even more significant, of course, is the way in which escalating expenditure on arms is going to suck a lot of the resources out of the kind of investments that many of us want to see. So arms control, peacemaking does seem to me to become increasingly important in that kind of very polarized world. And can we use nature and environment as a way of bridging some of these divides, Collaboration around scientific research, for example. I was involved many, many years ago in collaboration between Russian and American physicians in the Cold War. And this was a very interesting partnership which arose because President Brezhnev's personal physician was a cardiologist. And he collaborated with an American cardiologist called Bernie Lown. And between Chazov and Lown, they created this kind of collaborative initiative, bringing together physicians from both East and West. And I think we need to recreate some of these initiatives broader than just the health professionals, but also bringing in environmental and other scientists, because we need to collaborate across these boundaries. And I'm very aware that many of our colleagues, for example, in China, are very keen to collaborate. They're very open to collaboration. And I think we should welcome that. And we should ignore any request from political decision makers to cut these collaborations and cut this dialogue. It's really important that scientists take the lead, and we can overcome some of the distrust and the barriers, and medical professionals as well. So I think this is a good basis on which to work, because we have shared methodologies, we have shared approaches, we can find common ground, we can probably try to build trust over time. And I think the science community and the medical community both have a moral duty, in a sense, to try to overcome some of this mistrust that's fueling the arms race.
Thank you. Federico.
Yes, I just wanted to make a connection between war and violence in general. And I think that the response is very generalized to other points. In Salvador, where I live, we have a mortality by homicides, which is as high as many countries that are in war. And that is not just for Brazil, but for several countries in South America, in Central America, in Africa, and Asia. And that violence is very localized. And it's also associated to nature. And there are clear evidence between areas with higher violence and areas with higher incidence of zoonotic transmitted diseases and other mental health, etc. So something that we have noticed and that has been studied in other places is that by improving those areas of violence, improving the environment and having more nature as other solutions, also improves the life and the quality of life in general. And so just bringing that in a more generalized way, not just the war, but the conflict that is chronic across these places over decades.
Thank you. We have 5 minutes left to go, so let's just see what we can capture in these last 5 minutes. There was someone here who's been very patient. There's a question here, and then let's wrap it up with 2 very quick ones, if we can keep them short, please.
Hi, guys. So I just have a question in relation to Bristol as a city. But just before I go into that question, just 3 things kind of I wanted to bring together from things that I picked up. So the first one, I studied biology at Bath University about 18, 20 years ago, a long time now. A lot of these things were being talked about then. And I'm sitting here almost 20 years later, and the threat's bigger. There's more doom and gloom and crises and climate change anxiety, and all this is all doom and gloom and very negative. We've then got the huge complexity of it. As Sir Andy mentioned, you've got the individual all the way to planetary. How do you comprehend all that? All these very in-depth intellectual conversations. And then you've got the reality of it comes down to consumption, individuals consuming. My friend here, Joe, we met working on projects in Ecuador. And you can, when you're out there in the rainforest in the Amazon, you can see really all this stuff that's going on here is because there's people who are trying to get by, and they're, letting some merchant come in and chop down a mahogany tree. So for the West. So my question is, how do we bring all of that together and move, instead of planetary and individual, how could we look at Bristol, a city of 500,000 people, pull together all this stuff we've been talking about and say, what's the impact? Because 20 years on, do we know what impact Bristol's having as a city?
Thank you. So how do we bridge between planet and individual with a city-based approach? So we're going to leave that one there, and then there's two more very quickly if we keep them brief. There was someone here, I think. Fabulous.
Hi, I'm not sure how quick mine will be. It was in regards to the environment and well-being. I know access to green space has been something that's really helped with my well-being, and Chantelle, the work that London Wildlife Trust and with the project with the NHS sounds truly wonderful. But through that and the increased well-being of access to green space and connection to nature, I personally have felt increased capacity to take action on these issues that we face due to increased well-being. However, there's a lot of socio-economic issues in regards to connection to nature, whether it be access to green space in a local area, lack of gardens, travel issues, or work hours commitments. And I'm wondering what you think the tools we have that we can apply to increase connection to nature and environmental ecological identity within people in a way that's equitable and broad-reaching to the entire population.
Thank you very much. So what tools could we have that enable us to increase equitable access to nature? Fabulous, thank you. There was someone very patient. Can you keep it very brief, and we'll come to you, and then we'll go on the panel and see which one they'd like to respond to.
Thank you. Just on the economy point, I would say check out Natural England's State of Natural Capital report that was released last week. But my question is very quick, and some of you have touched on it already. I'd like to hear from the panel good examples of nature-based solutions.
Fabulous. Examples of nature-based solutions. Thank you. Great. Brief question. Super. Shall we just work around the panel? We have a couple of minutes to go. Pick your question, Andy.
Well, thanks. Well, first of all, about the city. I mean, I really think cities are a very exciting locus of a lot of activity at the moment. And I recently was contacted by a city in Finland called Lahti that you may have heard of. It sees itself as a planetary health city. So they actually have a planetary health physician, a medical practitioner who actually works to integrate kind of planetary health concepts into their health service. They have a whole economic plan which involves them, ultimately the city kind of living within planetary boundaries. Now you can't do everything at the city level because you also depend on national leadership and national legislation, but there's quite a lot you can do, and you can certainly mobilize local communities, and often local governments are much more in tune and in harmony and understand their local communities much better than obviously at the national level. So I would like to suggest that somewhere like Bristol, if it isn't already doing it, could become a kind of planetary health city, and think about what kind of strategies it could put in place to live within planetary boundaries, to give an equitable and good quality of life for its citizens, and also to work with other like-minded cities around the world, of which there, I think, will be a growing number. So I think that's a really positive potential activity that Bristol could lead on.
Great. We all need to look at the example in Finland. Thank you. Chantelle.
Maybe the nature-based solutions one, kind of leading on. Rewilding is amazing. I mean, it's this buzzword that maybe came to its head maybe a couple of years ago. And there are some great examples of large-scale rewilding projects like NEP in Sussex, Heal Rewilding, which is a relatively new charity that had an aim to source an area of land that was close to a city so that more people, and this also kind of goes on to the equitable access to nature because it is very skewed, to ensure that young people could access the site, people from underrepresented backgrounds who don't have safe access can get the coaches, they provide coaches and things like that. So it was really thinking about what were the barriers that these young people are facing or disadvantaged communities are facing, and what can we, and we literally sat down and had a youth board and kind of answered all of those questions in a very practical way. So I think, rewilding, which also, brings in animals as our help as well, because they are also a solution, and it intertwines with human health as well.
Marvelous. And Federico?
I think that I'm going to comment on that. I think that rewilding, reforesting is going to be a really important movement, and is having a lot of investment in Europe now, and I think it's going to be happening also in other parts of the world. But at the same time, there is a reflection from part of the community that rewilding, bringing new animals, also brings new dynamics to the system, and that could be
Okay.
potentially some risk of that. Nothing against rebuilding, which is really important priority, but also that we need to understand the dynamics of rewilding and rebuild and reforesting in order to understand and prevent epidemics and zoonotic diseases. So I've been part of one big study from the European Union that is evaluating that specific phenomenon on restoration initiative across the world.
So lots to think about there.
Yeah.
Thank you, Federico. Modi and then Gail, please.
Yeah, I agree. That's something you need to think about. But I would just, echo, the call for rewilding things like in urban areas, pocket parks, and just making the most of every bit of scrappy land to plant green, turn it into a community garden. So important.
Fabulous, thank you. And Gail.
So I was just going to answer the sort of quite complicated question about stopping deforestation and so on through land ownership. I think in Brazil there's been a lot of work done to show that if you give indigenous people land rights and you police those land rights and you ensure that they can get the benefits from the natural resources, they will look after them. And the first Lula government showed the success of that. It then picked a bit under Bolsonaro, but now we've got Lula back and they're reforesting again. So I think the hope for the Amazon rainforest yet is through that better governance.
Fabulous, thank you. Thank you very much, panellists. Thank you very much, audience. We're just going to stay here for a minute while Guy Howard comes up and closes the event. But let's all thank the panellists for their fabulous contributions.
So thank you very much. Thank you, Rachael. Thank you, all of you on the panel. You've been brilliant. You've answered questions. You've been very thoughtful. And we, as always, really appreciate that. So I'm not going to attempt to try and summarize everything we've heard. There's been such a lot there, and there's a lot of complex issues, a lot of different things to tackle. But I did have a number of key takeaways for me, personally, about what I heard that I think is I would like to reflect on. I think first is, this is a global problem, but actions can be local and arguably should be local. I think we're never good if we just say it's a big global problem, it's somebody else to fix. That's what we shouldn't do. We can make differences ourselves, in our communities, in our cities. It's about choice. So I think about that, and I think, going back to one of the things you said, Andy, evaluating how good those interventions are is really important. Because in the end, if we want to have evidence of what we do, if we want to tell the story of what's effective, we need to be confident that we understand that. I think I was very struck about the points about communication. And I really like your points, Lindsay, about be emotive. Emotion is good. I always tell all of my research students, they don't always like it because a lot of them are hard scientists, to say research is also about telling a story. So all these things are ultimately about us communicating, and communicating is trying to explain to people what they're seeing, what they can do, and having a narrative around that. So I think communication, and you all talked about that very eloquently, I think is really essential. We talked about, and I think one of the other big things that came across for me is around inequalities. Not just inequalities at a global level, inequalities at a local level within the UK, inequalities at a local level within the communities in Salvador and elsewhere. And actually, if we want to tackle issues around planetary and health, we have to acknowledge that different people have different capacities, we have different resources. And we are never really going to solve problems if we decide that we're going to do one set of things because it suits us, because we are wealthier or a wealthier country or wealthier community, if it's going to damage other people. And all the points I think that people brought out about this being linking into global issues of security, health security, and etc. is really important. The final thing I would say that really comes across is around leadership. And we talked a lot about leadership, and people talked a lot about political leadership. But one thing I would say back to all of us is that leadership is not just our political leaders who we choose to support, who we choose to vote for, or who we back in their pursuit of power. Leadership comes from ourselves. We influence change. Change happens when we make that case, when we influence the people who are there to represent us. And so we cannot individually abandon leadership. And just one final aside point, which is a small point because I love the question about economics. The point about, and I'm not an economist, although I've worked very, very many of them over very many years in government and elsewhere. But the point about economics is not necessarily the economics, and it's not the economic methods. The point about economics is what is the value that you're trying to achieve, and how do you look at the cost that is going to incur for you to get that. But the big driver of that is not the cost. The big driver of that is the value. And if you, as Gail still sits in government, I did previously, that's the bit that people don't get. It's what you value that should drive decision making, not necessarily what the bottom line is in monetary terms. So I will stop there. Thank you all very much. You've been a fantastic audience. Thank you again to our panel and to Rachael for chairing it, and have a wonderful rest of your evening, and hopefully see you next year.